Hello. Hi, my name is Sab. I'm one of the GP registrars from Oxford Deanery, and I'm doing this video because David from Menlo Park requested me, which I think is a fantastic way of connecting with other GP trainees and recruitment companies like Menlo Park across the country. Right, so today I'm in not in Oxford, as you can see, the sea behind me. To show you a little bit around. So this is Land's End Point in Cornwall, and I thought this would be a fantastic location to start my video series for Menlo Park, on the request of Menlo Park rather, I should say. Right, so today it's a bit of a general introduction because this is my first video. So I'm ST3 registrar. I started training in the middle of lockdown in August 2020, and then I did 1.5 years of hospital rotations across various departments, actually 3 of Oxford University hospitals. I did pediatrics to begin with, and I then did obs and gynae, a significant part of which was community obs and gynae. And then after that I did acute medicine. It's actually the other way around. I did acute medicine first and then community obs and gynae. And once I was done and dusted with all the hospital rotations, I did my ST2 GP stint. So the switch from hospital to GP land can be a bit tricky. I found it a little bit challenging because in the hospital, the most of the decisions are coming from the consultants, and you're shadowing them, you're doing the ward rounds with them, whereas in GP land, inside the consultation room, it's just yourself and your patient, and you have to make decisions. If you are stuck, you do get support from your supervisor, supervising GP of that day, and your fantastic colleagues. But initially, don't be surprised, don't be afraid if you get a little bit stressed. That's absolutely normal. I started doing half-an-hour appointments, and then after that, when I finished my ST2 GP stint, it was down to 15 minutes. Yeah. Okay, so bit about the hospital post. What did I learn from the hospital post, and what did I think I should have done better? I think I did a bit of community obs and gynae, so that was quite useful. I'm confident with contraception. I'm confident with implants, particularly because I've done the FSRH theory on implants. So, and then after that, I did the practical letter of competence for implant insertion and removal. So I did it because I've got a special interest in procedures and minor ops, and that's why I chose to do the letter of competence for the implants. In terms of pediatrics, I would say, lots of people study for the diploma. I did pediatrics during COVID, so the schools were shut down. We didn't get to see enough cases, but we did see few of each common presentations. But I think if you're not doing the diploma, then you can think of doing the AKT questions for pediatrics whilst doing the post. And acute medicine was quite busy with a lot of night shifts and a lot of ward rounds, where I think what is particularly important as GP trainees for us is the ambulatory care, because you would make referrals to the ambulatory care unit, which is what we did in our hospital setting. But it's important to know what ambulatory care is if you're particularly new to the concept. So that's something to learn. Portfolio is a big part of GP training. So I think what I've learned over the last 2 years is just you keep on doing your entries, cover all your capabilities. It might be difficult to cover all the clinical experience group in one rotation, but cover all your capabilities. What I did was try and match each ward descriptor of a capability with an entry, so that clearly demonstrates that you're covering that particular ward descriptor of this particular capability. Yeah. So, but don't pile up, don't accrue your portfolio work, because in the end you might struggle and it can be a bit of a challenge in the end. So take it easy, and do it as you go along, and yeah, enjoy your training. So that's it. That's all for now, and we'll see you in the next one. And before I go, I thought I would just show you the fantastic view that I'm enjoying and share with you guys as well. Have a look.